Hey guys, so a lot of people ask after we do an evaluation and we measure temperature, electrical activity and along the spine as well as heart rate variability, what does a scan, what does an evaluation look like? What's normal? What's going on with my child? So when we take thermography and the other scans that we do, we're able to kind of quantify and literally show you a picture of where your child's nervous system is stressed and stuck. Like I said, in Mother Goose Chiropractic, precision is paramount. We don't like to guess, we like to know. And that's why our targeted neurologically based care is the most effective for pediatric conditions like ADHD, sensory, behavioral, mood challenges, whatever it is, I know for a fact we can help your child. So what we're looking for are areas of imbalance. So as you can see here, red is no bueno, it is not good. That's showing us where there are areas where the spine is not moving properly, where the nerves are irritated, where there's swelling and inflammation. So your child probably isn't complaining of back pain or neck pain or headaches, right? But if their behaviors change, or they've been diagnosed with some sort of neurodevelopmental challenge or learning disorder or whatever it is, behavioral stuff, we see that all the time, autism, ADHD, everything in between. We can literally map and quantify where there's a breakdown in communication between your child's nervous system and why they're not growing and developing the way you want, why they're stuck on stress, why there's irritation. So when we can quantify these areas of stress stuck on, as we like to say, and we can get these areas moving with a targeted plan of care and start getting them adjusted, get these areas moving properly, those areas of the spine can heal and we get pressure off the nervous system, the brain can relax and release and engage what we call the brake pedal half of the brain. It's also referred to as the parasympathetic. You might have heard in your travels of the vagus nerve. So that's a big deal. If the nerves are irritated, your child is just stuck in a fight or flight stress response. As we get those areas of the spine moving properly so they can heal, it upregulates that growth and development half of the brain, the vagus nerve, the parasympathetic, the rest and repair. We call it the brake pedal half of the brain. Because a lot of these kiddos, again, whether it's ADHD or autism or what have you, they have a really overdeveloped fight or flight sympathetic system. That half of the brain is always on all the time. So all the challenges, all the symptoms, all the struggles, that's where that's coming from. So when we get a child checked and adjusted, after we can identify exactly where the nerve irritation is, where the problem is, we downregulate that fight or flight, help it shut down, calm, and heal, and we upregulate that brake pedal parasympathetic healing half of the brain. It's all about neurological balance, which is why we use such advanced technology in the office to measure, track, and quantify. And not only that, as we go through care, this isn't a one-time thing. As we go through, we regularly track and monitor your child's progress with objective assessments such as this, because we want to get them from here, nerve irritation, revved up, stress stuck on, no bueno, not happy, to clear, calm, connected, verbal development, focusing, being able to do it better in school, listening to directions, falling asleep easier at night, whatever it is. When it comes to neurodevelopmental challenges, we always find time and time again, in the work that we do here, it always goes back to the spine and nervous system, because if the brain is stressed and revved up and stuck and irritated, it doesn't matter what you do outside in to kind of force the system to change. When we adjust, we reset the internals, everything heals, everything comes online, and everything works better. So to get your child back, it all starts with an assessment. So getting your child's spine and nervous system checked is critical, it's paramount. If you don't have that information, you can do amoxicillin, elderberry syrup, OT, PT, whatever it is. You're gonna be forcing an irritated, revved up brain and nervous system to try and change an outcome. So what we do, we adjust, we allow the body to heal, we reset those internals, and then these kids fly. They do great. They respond beautifully. So that's why we do such detailed assessments, because the health of your child is the most important thing in the world to us. So if you haven't had your child's spinal nervous system checked and they're struggling with, again, maybe they've been formally diagnosed with, spectrum, ADHD, sensory, mood, behavioral issues, or maybe they're pre-K and they're just getting in trouble a lot, or something's not right. This is the key. This is the key to see what's going on and how it can help get that brain and nervous system calm and connected. And then from there, everything flows back towards what you want: growth, development, and to help get your child back. So this is one of the assessments we do. Gives us a lot of insights into why your child might not be where you want them to be, why they're not growing, developing, why they're not healing, or why they're struggling. So we would love to be able to see what's going on with them. If you have any questions, you feel free to let us know, and we're here for it.